Lymphedema is a chronic and debilitating condition due to the mechanical insufficiency of the lymphatic system, which over time causes abnormal accumulation of protein-rich fluid in the interstitium. This triggers a cascade of adverse consequences such as fat deposition and fibrosis, and as that condition gets worse, the patient will experience heaviness of the extremities, itchiness, and recurrent skin infections that eventually will result in a significant physical and psychological morbidity. The early detection and education are key in order to prevent the progression of the disease. There are current very good surgical techniques and approaches in order to help patients to decrease the progression of the problem. And still currently, physical therapy is the gold standard of treatment.
This video content is copyrighted by Mayo Foundation for Medical Education and Research.